Hey, babe, so today is the day we're about to do this, huh?
Yeah, I'm about to get ready to go to take the prostate test.
Big fun, huh?
I know it's necessary. It's like most men, you get a little bit nervous about the possibility of taking a test like this because you never know what the outcome is going to be. Hopefully here is just a preliminary test. I've taken one before, but you still feel a little bit evasive and a little nervous when you're going through the procedure.
Well, they're not going to find anything negative. All is good. And we're going to recommend to the rest of these men out there to give this best gift to everyone that they possibly can if they love their family.
Yeah, getting your prostate checked on a regular basis, especially if you're over the age of 45. They say it's between 40, start at 45, but definitely if you're doing it on a year, if you're at least 50 years old, you should possibly think about doing it every year, or at least go get doctor recommendation on how many times your prostate should be checked. But it's very important because if it's caught at early stages, it can be treated, and you can live a long life if you take care of yourself. But you definitely need to go get this procedure done, no matter how evasive it may feel or how you feel about it. It is something that most men will get. They say 1 out of 7 American men of their lifetime will be diagnosed with prostate cancer. So it's very important that you get the testing. Reverend Rick McCain from the Let's Stay Together show. We are at the Chicago Prostate Cancer Center here in Westmont, about to go through my procedure for checking my prostate cancer. Again, I want every male to listen to this, especially African American men. You should go get your prostate checked regularly and talk to your doctor. I'm about to go do that now to let you know about the test and how easy it is and how safe it can be. And you want to be able to make sure that your prostate is okay so you can live a long and healthy life. So I want you to come in and go in with me as we go in to take the prostate cancer test. Hello, how you doing?
Good, how are you doing?
All right. Hi. Rick McCain.
Oh, can I sign in for us?
Right here.
Nope. Right there.
Oh, okay.
Okay. So you're from the radio. You found us on the radio, correct?
Yeah.
Okay.
So am I nervous? Yes.
You should be. No.
Oh, she said this is the easy part, so relax now.
Deep breath.
If women could go through past mirrors, you could do
We ain't
this.
talked about that. We ain't even talked about that.
I'm glad you said it.
This is a man's role.
but you know what?
And mammograms.
They feel violated.
Yes.
They feel very violated. Okay.
Yes. Brenda McCain.
Spouse?
Yes. Who's that? Yes. She just jumped into my prostate cancer. Yes. I'm nervous and she just jumped in. I'm not gonna do it now.
You think you're getting out of here that easy? We're not letting you out of here.
You're going to be screaming.
Yes.
How about on your cell phone?
Yes.
How about at work?
No.
Michelle's from that now. Okay, so Jennifer, go ahead and sign. We'll go with those. And before I have you see,
Isn't that beautiful, Michelle? Hey, we are at the Prostate Center in Westmont with the lovely Jennifer and Michelle. I know Linda's back there. I didn't catch the other beautiful lady name, but I have to catch her name.
This is Reverend Rick McCain from Let's Stay Together show. I'm at the Chicago Prostate Cancer Center. Thank you. I'm getting nervous, I guess. We're taking a PSA, right? It's going to be a blood test that they're going to take, and maybe I can get Michelle to come over here and explain a little bit of what this is. So I'll have Michelle. She was on our radio show with us, the lovely Michelle, who was excellent on the show. Michelle, what's about to go on right now?
So we are going to take a PSA blood test. A PSA is prostate-specific antigen, and that's something that the prostate gland makes. If it is elevated in a man, that could indicate the presence of prostate cancer. Not always. There are a bunch of things that can affect the PSA, but that's what we're going to check today and see where Revrix levels are.
Now, I've heard them saying that no one has called in yet. Men, stop being afraid. Make the telephone call. It's important that you do this for your family and friends, and especially for yourself. And African American men, definitely make the telephone call. We have a video out there. We'll put more out there to help you make the decision to better your life at the Chicago Prostate Cancer Center. I don't know why that is. I never like to see the needle go in the arm.
You don't like needles?
Yeah, well, who does?
Who does?
They don't bother me at all, needles and stuff. I guess I was so used to going through all of this stuff, little getting shots.
Yeah.
Do you have any family history of prostate cancer?
No, ma'am.
Okay. And have you ever had a PSA drawn before?
Yes, ma'am.
Okay. And do you know what the level was when they drew it before?
I can't remember.
Okay.
Can you take it a video?
We have to get you when you scream.
Yeah. All right, little poke here, sorry.
That was nice. She's good. You hear that, man?
Not that bad, guys.
That was very...
You really didn't feel it, did you?
All right.
Just wait until you get to the screening.
Not even an ouch.
Nah, I mean, I didn't... That was the easiest little thing. I think a mosquito bite was worse than that.
Please hold all pages.
So, make sure you get Jones. Say, I want Jones.
You need Joan, is what you're saying?
If you want to get a needle in your arm with no feeling.
There we go. All right. So this takes about 20 minutes to get the result.
Okay.
We'll process this, and then once we have the result, then we'll meet with Dr. Moran, and then he's going to do what we call a digital rectal exam. And that's where he feels the prostate to see if there's any nodules or anything abnormal. So that's the second part of the screening. You always have the PSA blood test and then the exam together.
Okay.
Okay?
Great.
All right.
There you go. Going to the part 2.
There we go.
Come on, man. Come.
Okay, moving to the recliners in phase 2. And maybe even after one of the patients is out of the operating room, you can come talk to them as well.
Morning.
Come on.
So phase 2 is in the recliners. This is Wendy.
How you doing?
Basically, just sit here and go through the recovery period.
Yeah. So we make sure we give them something to drink, something to eat. We make sure they urinate, go over all your instructions. So the shortest time is in the operating room. The rest of it is more instructions and follow-up care. And then after that, they're free to go home. It's a one-time outpatient procedure, fairly quick and easy for cancer treatment.
Can you do me a favor and explain what you mean by they drop the seed in there?
Yeah.
That to me
What I
is
should
like,
do is show you
it's
some
kinda
seed
like-
samples.
what would that mean? I know I
How
saw
small
something
is
about
that
it.
seed?
Yeah,
Yeah, we're
I
gonna
can
get you a
show-
sample.
Because I know most of us men are a little bit nervous when you say a seed. It's like, what do you mean you're going to drop
Right.
the seed?
So once there's a diagnosis, there are many treatment options for prostate cancer, and one of them is seed implant or brachytherapy. And what we do is we get these small radioactive seeds, and we load them into a needle. And just like when you got your blood drawn,
Right.
instead of drawing blood, we'll drop these seeds into the prostate. So the seeds give off radiation and kill the cancer. And the nice thing about brachytherapy is that the radiation is contained right to the prostate gland. And their surrounding structures are
Yeah,
spared.
is that like a new technology? Because I know I was reading up on that.
Yeah.
It seems very interesting that now, instead of having to go through a total radiation in your body, you can now drop a seed in there and it'll be concentrated to the specific spot instead of the whole entire
Right.
body.
It's actually not new. We've been doing this since the 80s.
Oh, wow.
What's changed is the technique.
Okay.
And so the technology's evolved, the imaging, the seeds themselves, they become stranded, now they connect. So there's a lot. So the procedure of brachytherapy is not new. It's been around for many, many years, but techniques are always evolving.
And for those men that are scared about this, does that seed stay in your body? Does it dissolve? How does it work?
It does. It remains in the prostate forever, but it's not radioactive forever. So the energy, the radiation will dissipate, but the seeds will stay in your, and it's titanium. So just like if somebody were to have a screw in their ankle or a plate in, their hip or whatever, it's safe and it remains there.
So now that seed cannot be reused again.
No.
All right. Well, hey, that's very interesting for me to learn about that. And hopefully you men out there, please come on, join me and take this test because it's good for you in your life and the ones that you love. So, Michelle, that's what
It comes through a tube here called the urethra. And that urethra runs right through the center of the prostate. This is the prostate right here. It travels down from the bladder, down the urethra, and out the penis. This is why when somebody has an advanced cancer or they have an infection in their prostate or a growing prostate, they have urinary symptoms. And the reason for that is because the bladder and the urethra are right there. So if your prostate's getting constricted or it's inflamed or there's an infection or there's a cancer growing, it's putting pressure on the bladder, neck, and the urethra. And so this, again, here's the bladder, here's the prostate. Here's a very early stage prostate cancer, if those were cancer cells. So that's something you wouldn't be able to feel, you wouldn't have symptoms. And as it starts growing, you can see here how the tumors are getting bigger, and this is kind of getting to the edge of the prostate, reaching out a little bit. And this is a very advanced prostate cancer. It's completely outside of the prostate and invading other organs. And so this is where you don't want to be. You want to find things early, we treat it, we take care of it, and it's done. You can continue your normal life. This is just another picture, again, just to get a better idea of where the prostate is and how big it is. A typical prostate, an average sized prostate is about 40 cc's. And that would be like this. This is a normal prostate here. And what the doctor's going to do when he does his rectal exam is feel for any nodules. And if you feel here, Redvic, there's nothing here. That's a normal prostate. That's kind of how it would feel. If you feel this one, you can feel a nodule. It's almost like there's a rock or a pebble inside.
Yeah.
And so that's kind of, you're feeling a little something like this. This is a very advanced prostate cancer. If you feel it, you feel numerous nodules in there. The cancer is extending outside of the prostate. And something like this is an enlarged prostate. So it's bigger. Perhaps it's not cancerous, but it's causing some pressure during urination.
So now, what's the difference between this and that? I know you feel the nodules in here. This is enlarged. So I know this is not a good stage, but when you're here, what could be the symptoms that cause that?
An enlarged prostate will generally cause urinary symptoms. So you might have trouble urinating, you might be starting, stopping, waking up at night, you might feel urgency or a weak stream. This is not cancer. This is more irritative symptoms. We can put you on medication to help treat that. This is a cancer. If you don't treat this is actually a very advanced cancer. If you don't treat this, it will spread throughout your body and eventually cause death. There's no treatment. There's no cure for an advanced cancer. We can only treat it.
I asked that question because I'm very curious because I know for recently I have been getting up a lot during the night, going to the bathroom, and I'm like, okay, could it just be inflamed? Could that be a early stage of maybe prostate cancer? Should I be concerned?
Well, you should definitely have it looked at. You should have it checked out. It's obviously something, if you're waking up at night often, you're starting, you're stopping, it's bothering you, you should check it out. It could very well just be an enlarged prostate. It could very well be irritated due to physical activity. Sometimes an avid biker will have irritation in the prostate just because of where it's located. So there's many reasons for it, but if it's something that's causing symptoms, I would have it checked out.
And that's good, because I know for me, I want to make sure that I'm healthy so I can live a good life. And these symptoms that are coming up, a lot of times men get afraid and they just think it's just going to go away. But we need to get this checked out because, as you said, when it gets to this point, there's nothing you can do. But if you can get to early stages and they can do something like this to help you out, you want to do that.
Is obviously a huge prostate. This is, if your prostate was this big, we would have very much to be concerned about. But it's just an idea to show you where it's located. It's within the pelvis. And right here is the perineum. So if you're laying down and your legs are up, this is what it would look like inside. So here would be the skin. And this would be the rectum. And the reason that we do a rectal exam is because you can't feel the entire prostate, but you can feel the bottom of the prostate during the rectal exam. And that tube there, that's the urethra that I was talking about. That's where the urine travels through. And so this is just an idea to get a picture of where the prostate is in a typical, actually this is still a large prostate, but just to get a model of a prostate gland.
Scary question here. If you get a large, obviously this is just an enormous size compared to that. Say that I am in that stage, and I'm afraid, but I need to get that checked out. What can I do as a man, knowing that it can't be cured? What can you do to help me with a normal part of life if I get into that stage?
If the cancer had spread throughout your body, we would try to contain it with different medications. So there's hormone therapy. We would give you drugs to shrink down the tumors, to keep it from getting worse, not to cure it. Once the hormone therapies no longer work, there's chemotherapy. We can use radiation to alleviate pain in different parts of the body. Prostate cancer most often spreads to the bone. So if it does spread, it often is in the bone. So you'll have a lot of lower back pain, perhaps pain in the hips, the legs. These are all sound kind of normal, but it's a different thing.
But you're still able to continue with life.
Yes, okay. You can very well live for many years with prostate cancer.
And so that's something I want men to know, is that even if you're at an advanced stage, you still want to get checked out, because I'd rather live a extended period of life being checked out knowing that I have a serious prostate cancer issue than not getting it checked out and then passing away and not being able to take care of treatment. So it's very important that you do this. So Michelle, I am so happy. What else that we should know?
Again, we've reiterated early detection. The screening is simple. Do it once a year. Start at age 40 if you're African American or have a family history. And start at age 50 if you have no history. And just have a screening. It's nice to know your baseline. If your PSA jumps up, you know where you started. If your rectal exam becomes abnormal, you know that it wasn't always like that. So, and if you detect it early, there are numerous treatment options. You can treat it, and you can maintain your quality of life fairly quickly.
So you said something, because I was saying, I think I made a video on there saying at 45, but you're saying African Americans should start at age 40?
Age 40.
Why is that?
They don't know the exact reason, and further research will help us understand this in the future. But for some reason, African Americans do tend to have a higher incidence of prostate cancer, and when diagnosed, the cancer tends to be more aggressive.
So we got the young lady who took my
Joan.
PSA test. I was going to say Joan, who's coming in here to do some things as well, and so. Again, men, please, you have an opportunity to get something for free that can save your life. Who would not want to take that? Ladies, fool him, trick him, take him to
Let them
this
know they're going on a
location.
field trip.
Yeah, tell them that this is a beautiful field trip. You see wonderful things, and so you can bring him there. Make him go to take this test, because it's important, it's imperative, especially in African Americans at the age of 40. You want to start getting your prostate cancer checked on a regular basis once a year. And so definitely make sure you take this treatment as soon as possible.
Dr.
All right, well, the test is over. One of the easiest things I've ever done in my life, man. You definitely want to make sure that you get your prostate checked at the Chicago Prostate Cancer Center. It's very important, especially for men. I gotta constantly say this. African American men, if you're over 40, they say that you should get a screening now. And men that are not African American, when you get to the age of 50, please go get your prostate checked. You do this because you want to live a healthy and normal life, and at early stages, it can be preventable. So please, I just left. I want you to join me in leaving this office soon. Get your prostate cancer checked. We'll have all that information on our Facebook, Twitter, LinkedIn, Instagram, all the things that we're on. We'll let you know about it and continuously let you know about getting your prostate cancer checked at the Chicago Prostate Cancer Center. Thank you very much. I'll see you all soon. Woo!